Hey guys, this is Dr.KISHAN SHAJI Balaram and welcome back to my YouTube channel. So today in this video we'll be discussing as to how to revise the subject pharmacology in the 2-3 months before our Fmge exam. Okay, now I want to share a little incident that occurred to me which showed me why pharmacology is important in our lives, and I hope that this message spreads to you also. So this is a day when I was doing my observership in a hospital in my district, and a patient came. The history was like this, that the patient had breathing difficulties. He went to another hospital for this exacerbation and they provided inhalers, they did the nebulization, everything, and the patient felt okay and he went home. After 3-4 hours, the patient came to our hospital saying that he is feeling lightheadedness. He had some fainting episode. So the chief, which was over there, the emergency department physician, he asked me what could it be. So the very curious student that I used to be, I was thinking, okay, he had maybe taken salbutamol for nebulization. And if he had taken salbutamol, then there could have been an incident as there can be an overdose of it. मतलब ऐसे कि आपने ठीक तरह से नहीं दिया है या फिर आपने यहाँ पे कुछ ऑब्स्ट्रक्शन कुछ है जो आपको पता नहीं है, उसके वजह से ओवरडोज हो सकता है. Okay, then once I figured that this is due to salbutamol, I quickly remembered what could be the side effects that salbutamol has in the overdose condition. So the main thing that came to me was hypotension. So I told sir, it can be due to salbutamol overdose and it could be hypotension. So from that day onwards, I got that idea as it not only the drugs names and uses are important, it is also important to know how we use a drug, what all contraindication does it has, what all side effect does it has, and if in case a side effect comes, what all should be the treatment of that side effect also. So this was just a short story which I had. I thought would be relevant for you guys to know how pharmacology helps us in like every day during a clinical practice. So now let's get to the video. So in this video I'll be sharing like 3 main steps as to how we can revise pharmacology. First, the notes. I preferred my mentor as Dr. Patel because I liked the way he taught me, and his material is very abstract and it is very it has less number of pages as compared to other teachers and mentors. I'm not complaining like to that the other teachers are bad and all, but this is my personal choice and it worked for me, so I'm sharing with you guys. So what I did for my revisions is, once my classes or once my videos were over, you can also do this. Take 1 hour from your life, and what this 1 hour does, I'll tell you. Every day you take 1 hour. It can be in the starting of the day or it can be in the middle of the day also. So once you take that 1 hour, sit down, keep your phones, everything aside, take your pharmacology note and start from the first topic, that is the general pharmacology. Now, if we look into the statistics as to where the most number of questions are coming from in the exam from pharmacology, we know that the most number of questions are coming from general pharmacology and the ANS topics. And I myself took Fmge solutions, and I sat down and I made a tally system and I checked this, where was most of the questions coming from in pharmacology, so that I could have a better understanding of the subject and where I should provide more concentration to the subject that demanded that much. On the day 1, I started studying the general pharmacology and I completed the whole general pharmacology in that day 1. Now, listening to this, you may feel that okay, in day 1 you were just completing general pharmacology, there is more than 20 to 30 topics, how will we revise? See, this is a progressive step-by-step process, and the reward is at the top on your exam. Trust me, this process works. So day 1 you study your general pharmacology. Now day 2 you divide your 1 hour into 30 and 30 minutes. Now the first 30 minutes you will study general pharmacology and you will revise it in a much faster way because you studied it in your previous day. And the next 30 minutes you will study parasympatholytics and parasympathomimetics. It is a little heavy topic, so I require that you give your quality time to it. It's not about the number of times, it's about the quality that you give in it, right? Yeah, so you do that on your day 2. Now, day 3, what you will do is you will complete that 30 minutes of general pharmacology, you will complete it in 15 minutes or 20 minutes, depending upon your speed. But maximum till 20 minutes you have to complete it. So you complete the general pharmacology, you complete in the next 15 to 10 minutes, 15 to 20 minutes your parasympatholytics and parasympathomimetics, and the remaining time you give to your sympathomimetics and sympatholytics. And in day 3 you completed your general pharmacology and your INS topics, plus you revised your general pharmacology for 2 times now. You get the idea where I'm going with this, right? So this is the process. Now you may feel like, okay, I have completed 10 subjects and I cannot revise this whole 10 subjects and study a new topic in this 1 hour. So what we should do over here is that you should divide these topics. Suppose, say, I think there are around 20 to 30 topics in pharmacology which you have to study, and you can divide them as 5-5-5, or maybe you can divide them as 10-10-10 if you're going for like the endocrinology, or you can divide it by the systems. Say you are dividing your endocrinology, there are diabetics, thyroid, growth hormone, all that you can complete, plus blood you can complete in a week also. And you can divide these topics, or otherwise you can divide it like 10-10-10. First 10 set, once that whole 10 set you have revised, start day 1 in the second set. So day 1 you will start a new system, you complete it, next day you will revise it in 30 minutes, next system. Like that the cycle continues. See, being consistent is the only key how which we can crack pharmacology for the exam, because it demands it, because the subject's nature is of that kind. Unless and until you are thorough with each and every page, we can't say that we have fully studied pharmacology. Okay, so this was the step 1 as to how to complete the notes. Now step 2 is we should also do questions to be 100% ready for our exam. Now how to do questions? See, this is where the part you should use your own time and mentality as to where you can find additional times. Now every day you're completing this 1 hour, and if you have like 60 days, you can complete 30 topics, you can complete it twice, so 2 times your revision is done. Now for the MCQs, what can we do? The thing I did is that once the first 10 topics are completed, like the first set is completed, I used to do Marrow's question bank. Sometimes I used to take Fmge solutions and I would sit down, complete that entire topic, MCQs. I used to take a A4 sheet, I used to open my Fmge solution and I used to write each and every question's option, and in the last I would check it, giving me that self-satisfaction as I have studied something. It is rewarding, you'll also find it. So this is it. Once 10 topics are completed, do your MCQs of that 10 topics. Take a day out, you can take 2 days out and complete your MCQs. See, taking 2 days out doesn't lose your consistency. You are doing questions, you're revising it actively now. Till that 10 days you revised it passively because you're reading. Now you're doing the question, you're thinking, okay, this drug came, you have this side effects, what could be the drug? So now you're thinking actively, and this is also a good piece of revision that happens. Okay, now once the topics that the MCQs are completed, now you are 80% ready. The 20% I'll tell you. Now getting on to the step 3. Step 3 is that while studying pharmacology, we know that we tend to make mnemonics, and as we know pharmacology, each and subject has 2 to 3 mnemonics based upon the drug side effect, the uses, the effects and all, etc, etc. So to get that 100%, we should also know this mnemonics. So what I did was, I took a small 100 pages book and I wrote pharmacology on the first page, and I wrote each and every mnemonic on each page, and I wrote it what was it for. So say you have tetracyclines side effects. Now this tetracycline side effect, the mnemonic was tetra packet. So I wrote tetra packet vertically, and horizontally I wrote what each alphabet was meant for, and I made a whole book out of it. Each and every mnemonic was written on each and every page. So what it does now, where does it help this in you? See, at times where you sit idle, or you don't know what to do, or you just want to read some mellow stuff just to phase out the day. So at that time you can do this. You can take out your mnemonics book and you can just complete these mnemonics, giving you a little bit idea as to where this mnemonic comes in your book. See, the main thing is photographic memory, acquiring that photographic memory, and for that we are doing three ways in which we can comprehend this subject. Now, the mnemonic also helps us to revise in our last 2-3 hours before exam, where we are totally confused, we don't know like what we can do. क्योंकि मतलब जब मेरा एग्ज़ाम था, मुझे ऐसा लगा था कि मतलब यार अभी पता नहीं मैं क्या करूँ, क्योंकि मुझे ये पढ़ना है, एनाटॉमी देखना है, बायोकेमिस्ट्री का रिएक्शंस का एंजाइम सब पढ़ना है, क्या करना है कुछ नहीं पता। मतलब मैं पूरा कंफ्यूज था कि मतलब मैं क्या करूँ, क्योंकि इतना सब कुछ करना था मुझे, और उस टाइम का स्ट्रेस भी बहुत हाई था कि मतलब ये एक लास्ट ऑप्शन था हमारे पास, इसके बाद नेक्स्ट हो या पास नहीं हो, क्या करेगा किसी को कुछ पता नहीं। तो उस टाइम पे जब मैंने मेरा निमोनिक बुक देखा तो मुझे थोड़ा सा ऐसा अंदर रिलैक्स हो गया कि मतलब चल अभी मैं बाकी कुछ नहीं करूँगा, मैं मेरा निमोनिक्स रिवाइज करूँगा। और मैं वहाँ पे बुक बैठा, जो मतलब हमारा एग्जामिनेशन का जो सेंटर था, हम वहाँ पे बस में जा रहा, तो मैं बस में ऐसे निमोनिक्स एक पेज ऐसे रीड करके जा रहा था, 2 बार रिवाइज किया फटाफट। तो जैसे मैं ये निमोनिक्स रिवाइज कर रहा था, मुझे वो ये कहाँ पे वो बुक में होता था, ये कहाँ पे ड्रग्स के पास में होता था, वो सारे एक फोटोग्राफिक मेमोरी जैसा मेरे मन में ऐसे होने लगा। तो मैं भी ऐसा थोड़ा कॉन्फिडेंट था कि ओके चल, निमोनिक्स भी है किया मैंने, नोट्स भी 2 बार रिवाइज किया मैंने, और क्या MCQ भी किया। इससे ज़्यादा फार्माकोलॉजी में करना भी कुछ नहीं है। एक बार रंजन सर ऐसे मतलब हमारा ऐसा था कि पहले एक मेन क्लास था और फिर उसने एक बार रिवीजन के लिए भी आया था। तो रिवीजन का टाइम पे मैं गया था, तो सर ने पूछा था कि मतलब कौन कौन सा लोग पहले मेरा क्लास अटेंड किया है। तो हम सब ने ऐसे हैंड रेस किया, और फिर सर ने पूछा यार मैं खुद मेरे क्लास 2 बार ना सुन लूँ, तुम लोग क्यों आए हो। मतलब सर ने ऐसे मजाक में बोला था, बट सर ने फिर एक बात बोला था कि मतलब यार मेरा सुनना ठीक है, तुम वीडियोस देखना ठीक है, बट जो मेन और मोस्ट इम्पोर्टेंट ये है कि तुम तेरे नोट्स के साथ पूरा कॉन्फिडेंट रहो। उसके लिए तुझे पूरा नोट्स पक्का सा ऐसे फोटोग्राफ मेमोरी होना चाहिए। और ये मुझे रियलाइज़ हुआ कि मतलब यार वीडियोस देखना होता है, हाँ होता है, समझ आता है, कॉन्सेप्ट क्लियर करना होता है, बट कितने बार हम वीडियोस देखेगा, कितनी बार जो कॉन्सेप्ट तुझे पता है फिर से वो करेगा। नोट्स तो होना चाहिए ना, जो ये, क्योंकि ये जो नोट्स हैं ये हमने बनाया है, और इसमें वो जो मेमोरी है कि मतलब सर ने क्या क्या बोला था, कहाँ कहाँ बोला था, क्या क्या साइड इफ़ेक्ट्स होता है। तो मैंने ये प्रायोरिटी रखा कि मतलब मुझे मेरा नोट 100% आना है, और उसके लिए मैंने हर एक दिन से मेरा 1 आवर लेके रखा कि मतलब मुझे फार्माकोलॉजी करना ही करना है, क्योंकि सब लोग ऐसे सोचते हैं कि फार्माकोलॉजी एक छोटा सब्जेक्ट है, उसमें सिर्फ 10 से 15 क्वेश्चन आता है, बट यू आर pharmacology is that subject which has links to all clinical subjects. Maybe it can be internal medicine, it can be surgery, it can be gynec obstetrics. Now, where does this play a part is that psychiatry, orthopedics and all, in that you have to study drugs. Psychiatry, there will be a definite question from the drugs. Now, if you have studied your pharmacology, now while studying your psychiatry, the drugs part of your is covered. You just have to go through it fastly, just revise it fastly. In the same manner, if you go for anesthesia, you have a lot of drugs. You have blockers, what are the local anesthetic drugs, everything. Now, for me, I have completed my pharmacology thoroughly. So, anesthesia was a little bit easy for me, as all the drugs I knew, what are all the side effects, what are all the uses. I just had to study the anesthesia perspective for that drugs, like the color, what are all the scores and all. Now that made my studying of pharmacology much helpful for me. Now internal medicine, there will be a short question as for this disease, what will be the drug of choice. You have to rely upon your pharmacology knowledge for that. You cannot leave pharmacology. It is not a short subject. It is a small subject, but it is a demanding subject for your exam. And I'm telling this for my juniors, my all other Fmge friends out there, please don't skip pharmacology. And the reason why I'm doing this video is because of this, as everyone tends to leave out pharmacology saying that यार मेरे से होता नहीं, इतना बाय हार्ट करना, इतना ड्रग्स का नाम रखना मेरे से होता नहीं. बट आई एम टेलिंग यू, एज अ डॉक्टर इट इज़ इम्पोर्टेंट टू नो आवर ड्रग्स. अगर आप एक क्लिनिक पे बैठ रहे हैं, आपको ड्रग का नाम नहीं पता, तो मतलब आप सिम्टम्स आइडेंटिफाई करके उसको ट्रीट कैसे करेगा, है ना. मतलब ड्रग्स का नाम जानना ज़रूरी है. Unless and until you're going for a non-clinical subjects in your PG. बट उसके लिए भी आपको FMG क्लियर करना पड़ेगा, उसके बाद नीट PG भी क्लियर करना पड़ेगा, जहाँ पे भी आप फार्माकोलॉजी पढ़ना है. सो जस्ट एक्सेप्ट द फैक्ट कि फार्माकोलॉजी पढ़ना है. और जिन लोगों ने अभी पढ़ा भी नहीं है, अपना नोट्स लेना, और जैसे मैंने बोला हर दिन 1 आवर पढ़ना प्लीज़. इट विल हेल्प यू एंड आई एम श्योर अबाउट इट. सो जैसे हमने डिस्कस किया 3 स्टेप्स, नोट्स, MCQs और निमोनिक्स. ये तीनों आप रिवाइज कर दीजिए एंड आई एम श्योर यू विल स्कोर गुड इन योर FMG एग्जामिनेशन ऑन फार्माकोलॉजी एंड अदर सब्जेक्ट्स. सो दिस इज मी signing off, and this is the end of this video. We'll be back with more educational videos as of this. Thank you for listening out to me, and have a great day.